Start. Mm. Zoom share. Okay. On. So very good afternoon to everyone. So myself, Dr. Keerti from ABP Research Foundation. So today we will be discussing about Ayurvedic recommendations for liver care. So liver disease is an liver disease is a collective term. So the it is a very broad term under which n number of diseases has been mentioned. But in simple way of understanding any injury or any distress, any stress to that particular organ or a liver, which cause an inflammation of the hepatic cells uh, by any cause, it can be considered as liver disease. So before going to preventive aspect, uh, we will just know from the layman's view what are the concerns regarding the liver. So from a layman view, everyone will be knowing about the alcoholic, like excessive intake of alcohol may leads to liver issue. So everyone will be aware of the same. And other than that, yeah, everyone will be aware of diabetes is close related to liver, and jaundice is also related to liver conditions. So other than that, excessive drug-induced liver toxicity. So drug-induced liver toxicity, even from some there are some n number of drugs having in a label itself, like a long-term usage of particular drug can cause liver toxicity. So it has been mentioned, but still the people are not aware of the same thing. So that should be highlighted. So these are the general concerns by the layman. But other than that, there is least unnoticed concerns are infertility, eye disease, and atherosclerotic diseases. So all these three are like burning area. So all these three has its own cause at the liver. So this liver also has its own systemic functions. So which ha which helps in um, So these are the least concerns. So other than so before going to preventive aspect, we must know how liver is helping to our body, how it is connected to other body systems, how it is connected to other systems of our body, and how it is helping other body system in a great way. So here comes the importance. As we all know, liver has its own more than 500 vital functions, which helps in metabolism, detoxification, and synthetic functions. So, in relation to circulatory system, it produces clotting factors and albumin, which helps in blood coagulation and preventing excessive blood bleeding as well as fluid imbalances. So, it also filters the blood and then it circulates throughout the body. In relation to digestive system, it helps in uh, particularly in digestive system, it more acts on, it helps in fat metabolism. So whatever we eat as a in a fat, liver has its own effect. Like it will emulsify the fat, and again it will give us the benefits of the fat to the through sending it to the gut and intestine, and then we will get nourished by the same. So this is how it helps in digestive system. Coming to endocrine system, uh, it metabolizes hormones like insulin, thyroid hormones, and sex hormones, and also it synthesizes the carrier proteins for their transport. So anything which hampers the liver also hampers this hormonal imbalance. So coming to immune system, it helps as an immunomodulator and by giving inflammatory responses. And coming to nervous system, it has an like gut brain axis in the similar way liver brain axis. The reason, so by through that neural signals sensing metabolites like glucose and lipids will be triggered, and that is how satiety and medical metabolical adjustments via our afferent nerves will be sensed. So if it is triggered, the liver get build up of toxin, and that lead to hepatic encephalopathy too. So coming to muscular system, as it is in storage of glycogen, it releases glucose, which provides energy to the whole body, muscle contraction, as well as its protein synthesis helps in muscle repair. Coming to skeletal system, it stores vitamin D and K, which is helpful for bone mineralization and growth and development. Coming to respiratory system, it helps in carrying oxygenated blood, as well as carrying proteins and energy through metabolism. Coming to urinary system, it helps in uh, it helps in process the waste into bile for excretion, which in turn reduces the kidney work, and this poor its damage causes an hepatorenal uh, distress. So coming to reproductive system, as it has been earlier discussed, it releases the sex hormone, as well as it produces binding proteins, which is very essential for the fertility and also for development. So these are the main important functions of the liver. With a different system, it has its own functions. Coming to like in a crispier way, its important functions are it it has its metabolic regulation. It acts as a detox, as well as waste processing, and it helps in protein and blood synthesis, as well as it helps in supporting digestive system and immune modulator and storage roles. So coming to Ayurvedic view, so in Ayurvedic view, liver is termed as Yakrit. Yakrit has direct relationship with Rakta Dhatu, Ranjaka Pitta, and Agni, that is digestive fire. So therefore, this disorder can be considered under, as it is a seat of Pitta, so it can more considered under Pitta dominant disorders in Ayurveda. So it can be accumulated. I mean, it can be associated with kapha and vata also in different with the different presentations. According to that, treatment principle will be changed. So, as per on the basis of Ayurveda, so there is dosha dhatu mala siddhanta. So, ekrit in relation to dosha, so ekrit ranjaka pitta se sthanam, which means ranjaka pitta is also comes under the type of pitta. So, this liver and spleen are related to ranjaka pitta. So, it is pitta dosha is involved here. And in relation to dhatu, again, uh, so after the ahara rasa, after the intake of ahara, the ahara rasa produced is carried over here, and the conversion of rasa to rakta dhatu happens in the liver. So this is how and the formation and maturation of the blood takes place at this particular area. So this is how it has been related with formation of dhatu in respect to liver. So coming to mala, so there is a disease called Kamala, in Tamil Kamala Noi, Manja Kamalai, in English it is jaundice. So jaundice of obstructive nature has its own clinical features like Tilapisteniba, which is nothing but a color of the feces or the stool will have a color of paste, which is of sesame seeds. So this is how it is being presented. This is due to it's like obstruction of pitta, as well as the improper functioning of the ranjaka pitta due to the severe distress to the liver. So even the treatment aspect has been told to improvise the ranjaka pitta. Until the first line of treatment is to be given to improvise the ranjaka pitta until the color of the stool changes. So this is how in Ayurveda the liver functions and anatomical positions and physiology has been mentioned. So coming to liver disease, particularly the causes. It has been classified into three: dietary causes, lifestyle causes, and other causes. Coming to dietary causes, excessive intake of oily and spicy food, fried food, fast food, excessive alcohol consumption, excessive intake of sour, pungent, and salty food, and stale and packed food. All this will cause can be a nidan of the liver disease. Um, So coming to lifestyle cause, sleeping during the daytime and awakening at the night, mental stress and anger, irregular eating habits, and lack of physical exercise. And one more is suppression of natural urges. All this is an habitual cause and a lifestyle cause. So this also needs to be kept aware to be prevent in a preventive aspect. Other cause long-term use of medicines and infections. So this is a particular thing, long-term use of medicines. So even I have seen I have seen 2 to 3 times so many people will without the consultation of doctor they will do self medication with the help of the pharmacist. In the medical shop they will just go and get a medicines for this condition you please give the medicines. So likewise without the consultation to take the medicines for a longer duration. Um, the the even though the medicine is help in repairing the body, if it is used for a longer period of time it may again causes a distress. So this again will lead to a liver impairment. So this is how we need to be aware of all these things. So self medication is highly not appreciated. So the liver disorders in Ayurveda can be called as Ekrit Roga. Some higher in higher level can be go to Kamala, Ekrit Vriddhi, like it can be correlated with hepatomegaly, and Panduroga in a kind of symptomatic um, presentation, and Plihane Ekrit Vikara. So the any disorder might mostly with the predominant dosha. Other sometimes it may be associated with kapha and vata dosha. So according to that, the treatment plan will be changed. So these are the common herbs used in the liver disorder. These are the hepatoprotective drugs. All these drugs has its own research papers. There are n number of papers available for these drugs acting is its own aqueous extracts or extracts has an evidence of hepatoprotective activity. So basically, Boonimba, Bhumi Amlaki, Kumari, Aragvada, Bringaraj, Amlaki, Rohitaka, Pippali, Draksha, Nimba and Kiratatika. All these drugs has its own effects, and uh, it has a property of Ekrit Uttejaka, Ekrit Rohahara, Ekrit Pustikara, uh, like in a different orientation. Coming to preventive aspect, so first thing, precipitation factor should be avoided. So what are the cause has been mentioned earlier that should be avoided first. Second is as we all know, fat metabolisms occurs at the liver. So any fat, if the liver itself is get damaged, there is a more accumulation of the fat. So when the person is affected with the fat, sorry, with the liver, he is supposed to refrain from the fat products. But in Ayurveda, the medicines, which is medicated ghee or medicated ghee, has been told in so many places in though in the liver condition. But the drugs which is processed with the ghee has the property of sharp quality, which helps in um, clearing the channels or clearing the accumulated malas over there in the liver, particularly. Again, it rejuvenate the liver in the similar way. So, and one more remedy is like Pippali Kshira Kashaya has been mentioned. So, 2 grams of Pippali can be boiled with Kshira and can be taken in an like twice a day in before food aspect. And Bhumi Amalakiswarasa, it's like Kilal Nelli in Tamil. So it can be taken, its juice can be taken in an empty stomach. And other combination of powder which contains Ela, that is Elakai, Jeerakam, and Keela Nelli and sugar. All this together in equal quantity mixed with the ghee can be taken in the early morning in the empty stomach. And again, Haridra Churnam with curd also helps for it acts as an anti-inflammatory and also an detox for the liver care. Other than that, for a proper digestion, we can have a ginger slice with a salt before or after meal. in every 3 meals. And other than that, we can have a pomegranate juice along with ginger juice, like quarter part of the glass can be taken regularly for a better preventive care for the liver. So other than that, food items and some common herbs used for preventive care is red rice, yava, goduma, mutka. That is red rice, barley, wheat, green gram, and coconut water. All this has its own research papers. All this the listed pulse, rice varieties, vegetables, fruits, and spices. Everything has its own research paper available in the website, which has its hepatoprotective activity, especially ever, even at the level of alcoholic fatty liver condition, it helps in eva is helps in alcoholic fatty liver condition, and bottle gourd also helps in alcoholic fatty liver condition. And particularly apple seeds, this is so many research paper has been found that, apple seeds also can be used in this liver. And liver has its own property, like special property, like it helps in metabolism, like hemostasis of iron. So ginger, and kaideria, or jeeraka and ginger are rich source of iron. So this helps in maintenance of the liver. This helps in maintenance of the liver by providing various actions. So coming to so these are the preventive care can be done from the layman perspective. He can take all these are easily available and able to easily available ones, so he can able to afford the same. So those are the drugs which is easily available and affordable has been listed out, and all this having the hepatoprotective activity, and also has its own scientific research papers. So when one person needs to meet a doctor, uh, so because it is early stage, like even in the indigestion level, we will be ignored. Okay, so when we have the preventive care, it's not an issue. When the person is having the early satiety due to indigestion, excessive thirst, early malaise, itching all over the body, nausea, like feeling of vomiters, um, particularly at the pain or feeling tenderness at the level of right abdomen, right upper abdomen, or any abdominal distension, any changes in the color of the stool, any swelling at the level of legs and hands, any discoloration, like particularly yellow discoloration in the eyes, urine, skin, nails, mouth, and feces, and particularly redness and warmthness, feeling of redness and warmth in the palm region, particularly helps. Um, Particularly need to contact a doctor, because these are the signs and symptoms. These are the expression when the liver is getting under distress for a continuous long duration. So this is how you need to check when there is an um, when there is an these kind of symptoms or experience. These are the it is to be understood some distress is happening inside the system. So as we all know, Rashaushadis has its own like so many metallic or mineral basmas or anything has its own complication or side effects or causing toxicity, has more n number of papers are available. But still, Acharyas has mentioned or in all this liver disorder, there is usage of lohavasma in common, because liver has its own function. Here clearly mentioned, the liver produces hepcidin, the body's master iron regulation hormone. Hepcidin controls iron entry into the bloodstream by acting on enterocytes, macrophages, and liver stores, and thereby maintaining iron hemostasis. So iron hemostasis um, happens in the liver. So with the help of the liver, so it is very important. to maintain a liver, because with the help of iron only, the body able to maintain the strength, stability, as well as strengthening stability or capability of the bala, varna, ojas, everything attains with the iron only. So it has its own effect, not only just synthesizing of enzymes or some other reason. It has its own effects, own effects also. So coming to Rashtraushadis, yeah, we can use aloha basma with Triphala churnam for good absorption. In modern they say is vitamin C. Any aloha basma can be used with vitamin C. So the same has been documented earlier, like years back in from 13th century. From Rasaratna Samuchaya, they have mentioned aloha basma can be taken along with Triphala churna and along with honey and ghee. Which helps in from the Pandu to the Yakrat Liha Rogas. Again, Shunti has its own effect. It has its whenever the loha is given along with the Shunti Chuna, the loha basma will get absorbed in the body in a very quick manner. So this is how Acharyas has been designed in the previous days. Other than if you have any restriction to use this loha basma, then you can go for an drugs. Again, the Shunti, Jiraka, Bringaraja also has its iron content. The drugs having iron content in a larger quantity. Like particularly Bringaraja in Tamil we say Karisalangani. Mm, the name Karisalangani means um, Kari, Karisalar means um, after juicing the bringaraj, that is after juicing the bringaraj, the juice we obtained would be in black color, which suggests the presence of iron in the excessive, I mean, like nominal amount of iron in the drug, again um, suggesting it is a source of herbal iron. So it can be used accordingly. So all the medicines, any medicine should be taken under medical supervision only. So coming to takeaway home message. So protecting gut health is the most important one. That is what Ayurveda teaches in the from the starting of the disease from the Jvara Chikitsa. And most importantly, protecting gut health is very close to the savior of the liver, and also not only the savior of the liver, as liver is connected with every other system, so it has its own effect over other system also. That is why Acharyas has documented in the similar way. So it is very important to protect the gut health. Uh, so in turn, it helps in liver savior as well as in other diseases. And we have seen other list of hepatoprotective diets as well as the hepatoprotective home remedies, as well as the always use of loha kalpas in liver condition. And very importantly, the cause is not only for liver diseases. This liver disease can be an cause for an infertility as well as an eye disease, as well as whenever the liver is under strain or under distress, there will be a chance of accumulation of fat in our body. So there is a variation, there will be a variation in lipid profile if we get a test. So obviously, if the lipid profile, there is a change. High cholesterol level, gradually it goes to atherosclerotic changes. And this is how it is hampering the other system. So this is whenever the other systems is involved, we have to see the root cause. We have to treat from the liver. So this this will help to recover the condition as soon as possible. Thank you.